Welcome back. This is Good Morning Namibia. Now, malaria cases have been increasing significantly in most malaria endemic regions of Namibia over the past 4 weeks. As of 25 January 2026, the country reported a total of 8,760 confirmed malaria cases from week 1 to week 4 in 2026, compared to 5,229 cases for the same period in 2025. This represents an increase of 68%. A total of 604 malaria admissions and one malaria death had been reported as well. The Ministry of Health and Social Services detected 20 health districts that have surpassed the epidemic threshold and are experiencing malaria outbreaks. Joining us with more on this is the Public Relations Officer of the Ministry of Health and Social Services, Mr. Walter Kamaya. Good morning, sir, and welcome to Good Morning Namibia.
Good morning to you in the studio, and thank you for having me on this program of Good Morning Namibia.
Indeed, a very important conversation. Please help us understand which are the factors that contributed to this 68% increase in malaria cases compared to the same period last year, sir.
The factor that might have contributed to this is the issue of the refusal. When the ministry dispatched the team to go in the communities to do residual spraying, they faced a lot of refusals. The other effect that could have contributed is the high rainfall. When we have high rainfall, or we may all know that Namibia usually experiences seasonal malaria transmission. The seasonal peak starts in December and lasts until the late April, last week of April. We were on a mission with the ministry, conducted a campaign to try to educate people to make sure that they clean up their surroundings. They remove stagnant water around their places. They weed the unwanted grass and so forth. These are factors, or these are things where mosquito can breed comfortably. Then when they breed from there, they come bite us at night.
Thank you for that overview, sir. Please give us a rundown on the affected districts and the patients and where the majority of confirmed malaria cases had been reported.
The affected health districts that have surpassed the epidemic threshold and experiencing malaria outbreak are districts like Andara, Nyangana, Nyamagoro, Nkorenkoro, Inana, Ingela, Okongo, Grootfontein, Katima Muliro, Rundu, Tsumek, Oshwarongo, Omthia, Sandi, Otapi, Okahao, Puo, Oshikuku, and Oshakati. The majority of the patients with the confirmed malaria cases, they are from Katima Muliro district with 1,448 cases, and then that accounts for 17%, followed by Otapi district with 1,287 cases, accounting for 15%.
Now, sir, what does it mean for a health district to surpass the epidemic threshold, and why is this significant?
Yes, when the number reaches, or when the number exceeds a certain number, that constitutes an outbreak. We have a number to say that when this number, or when the confirmed cases exceeds a certain number, and then that could be classified as they have surpassed the threshold. For us to be able to say we have a breakdown, we have an outbreak, there is a number that we are looking at that is guiding us to say once you go beyond this should be classified as an outbreak.
I'm sure this matter deeply concerns the ministry. And as we wrap up our conversation this morning, please speak to us about additional strategies that are on the cards to assist the ministry to better and more effectively manage these outbreaks.
Yes, the ministry has advanced as a ministry, we have advanced our surveillance, whereby the ministry has a robust surveillance system in place and is on a high alert to detect and monitor malaria cases. The ministry also have embarked on a strategy of community education, whereby a robust community education campaign is underway to raise awareness about malaria control and prevention. Also, the ministry intends to come up with what we call capacity building. This is an aspect where the ministry hopes to strengthen the capacity of health facilities and healthcare workers across the country to manage malaria cases effectively. This includes identifying priority areas, training, and distribution of standard guidelines. Another strategy that the ministry intends to take is to collaborate with stakeholders. The ministry intends to collaborate closely with relevant stakeholders, including local authorities, non-governmental organizations, and development partners to ensure that coordinated and effective response to malaria outbreak is implemented.
Thank you so much for your time, sir, and best of luck to you and the team.